Many health experts agree that heart health should be a top priority for older adults during their golden years. Aging brings about many consequences to the physical body, including changes in the heart and blood vessel structure and function. Thus, increasing the risks of seniors developing mild to severe heart conditions like heart attack or heart failure, stroke, coronary heart disease, etc. In fact, the CDC reported that 21.7% of seniors aged 65 and above had been diagnosed with at least one of the diseases mentioned. Senior heart health is an essential aspect of your physical well-being that you need to take a closer look at. Early heart disease may not always have visible symptoms, most of them are barely noticeable. There are usually minor inconveniences or uncomfortable feelings that signal the onset of heart disease. However, most seniors wave it off as something normal and non-threatening. Not all heart problems demonstrate a clear warning sign, but some do. So, watch out and never ignore these 7 indicators of an unhealthy heart. Warning sign number 1, chest aches and discomfort. Pain, tightness, pressure, or discomfort in the chestal area is a classic sign of a heart problem. Many people describe this feeling differently: a burning sensation or an elephant sitting on the chest feeling, but it points to a single conclusion: an unhealthy heart. Chest pains occur for different reasons. It can be due to a blocked blood flow because of a blood clot, low blood flow, causing plaque formation that constricts the arteries, death of heart muscle cells, and inflamed heart sac. This discomfort is usually characterized by a slow buildup of pain or tightening in the chest that lasts for a few minutes. It commonly happens while doing an exertive physical activity, but sometimes it can also arise when you are at rest. Warning sign number 2, fatigue. Fatigue or a prolonged feeling of tiredness can be an indication of many illnesses. But not many people know that it is also a warning sign of impending heart disease. An unhealthy heart experiences difficulty pumping enough blood and oxygen to the body's tissues, causing you to be easily winded when doing simple activities. If you notice yourself getting exhausted quickly, which has never happened before after a flight of stairs or an errand, then you need to visit your GP, get yourself checked, and take care of your senior heart health. Warning sign number 3, irregular heartbeat. Irregular heartbeat, also known as heart palpitations, happens typically as a result of too much caffeine, nervousness, or anxiety. But when it happens out of nowhere and in frequent intervals, then the problem lies in your heart. There are several reasons why an unhealthy heart increases its heart rate. This includes compensating for its loss of pumping capacity, changes in the heart muscles that causes scar tissues to develop, and electrolyte imbalance. When you experience palpitations, it is crucial to note how it happened, were resting or doing a strenuous activity, how it feels, and how long it lasted. Warning sign number 4, persistent cough. Typically, coughing or wheezing has something to do with your lungs or throat and not the heart. Coughs that result in the spewing out of whitish or pink, sometimes blood-laced, mucus indicates that something is wrong with your heart. This can be due to the buildup of fluids, sometimes blood in the lungs, because the heart cannot keep up with your body's demands. Warning sign number 5, swollen lower extremities. Swelling in your feet, ankles, and legs may indicate compromised senior heart health. Many diseases can cause swelling of the extremities, kidney failure, and liver problems. That's why it is often overlooked as a sign of another illness instead of a heart problem. Edema or swelling in the lower part of your body occurs when the heart cannot pump blood properly, causing deoxygenated blood to pool in your tissues. Heart problems can also cause the kidney to experience difficulties in removing extra water and salts in the body, thus retaining it in the tissues and causing the lower extremities to bloat. Warning sign number 6, nausea and dizziness or lightheadedness. Feeling sick or feeling like you are about to faint can point to many mild health conditions. It can be just because of the food you ate or the lack of it, low blood, or standing up too fast. Nausea and dizziness are general symptoms of many illnesses. Then you should not rule out the possibility of a heart problem. These symptoms happen due to low blood pressure because of the heart's pumping difficulties, the digestive system gets poor blood circulation, and not enough oxygen going to your brain because of pumping problems. Warning sign number 7, sleep apnea or snoring. Light snores when you sleep are normal, especially when you had a tiring and busy day. However, loud snores, together with a choking or gasping sound, might be an early sign of a heart problem. Sleep apnea refers to a bout of loud snores accompanied by seconds of breathing pauses during sleep. It can also be experienced with chest pains, restlessness, and choking sounds. Not all sleep apnea indicates weakened senior heart health, but it can cause or worsen one's heart problem. Moreover, studies suggest that it causes hypertension and heart palpitations, which can exacerbate or trigger heart disease. Protect your heart by eating healthy, exercising, and going to regular checkups with your doctor. Even if you do not feel anything out of the ordinary, it is essential to do routine checkups to monitor and know the state of your heart health. Some frequent medical tests to check your heart's health are electrocardiograms, blood tests, echocardiograms, exercise stress tests, nuclear stress tests, and coronary angiograms. If you enjoyed this video, please leave a like and consider subscribing for more health and fitness tips. Thank you for watching.